Hello, and welcome to the Doctor's End. I'm Marcia Boyles, and I'm delighted to begin this program by introducing the principal of the show, Dr. Sethi, who is one of the primary doctors over at our medical center. Dr. Sethi, I think we have an interesting program and wonderful guests today. We have the mental health team, which is the topic that we're covering today, the mental health team from the medical center. And let me begin by introducing them. Kathleen Taylor, who is the clinical social worker, and Ashley Falcone, who is a psychiatric nurse practitioner. Welcome, both of you. We're delighted you're here.
Thank you.
With that, I'm going to turn it over to Dr. Sethi. Would you like to start us out this morning?
Why not? So, as we were thinking about a topic today, we thought that mental health would be a good one because we haven't spoken about it. And I think we've been remiss not to pick up this topic sooner. And the reason I say that is because we all very easily know when we've got a pain somewhere or something else that needs attention, and we seek medical help. See your primary physician if they're outside, or call the medical center to get help. And that's a good thing. But mental health is even more important, if I may say so, and we'll elaborate on that more, than physical health. And the reasons are, number one, it's very common. And number two, we tend to downplay it. And we really shouldn't do that. So, with the team we have here today, I hope that what we can do is do three things. First of all, to say it's okay to get help and when to know that you need help. Secondly, to know that we have a team, because we really do. And it's a very good team. And of those who've met you, Kathleen, and Ashley, they know that. But we want to encourage everybody to use the services that are available. And lastly, to mention that like physical health, which has so many components, mental health has many components. And so the approach to mental health is not a push-button approach. Bingo, we'll give you a medicine and it's all going to go away. It's not the way it works. And so I'm sure we'll be hearing more about that from both of you. Mm-hmm. And so with that, just some general statistics. Roughly 19%, or 1 out of 5 adults in any given year, will have a mental health issue. And 1 out of 24 to 25 will have a serious mental health issue. And these happen at all ages. So with that background, I think it's good for us to move ahead and ask, how should we proceed from here on? And Kathleen, you can start, if you would. How should people get help?
Well, yeah, I mean, it's a huge topic, what we're talking about today, and really, really important. I think that mental health is just like any kind of health care, that our main goals are to, as much as possible, alleviate distress and to contribute to a person's well-being, quality of life, in however way we can. So my approach is to use psychotherapy, counseling, talk therapy. There's lots of terms that we can use. I kind of like, though I don't really say it out loud too much, I like the idea of talk therapy because that's sort of what we do. We have the conversation, the therapeutic conversation that we have with one of our clients is the therapeutic process. That's how we find out about them and find out more about what their concerns are, and then work with them based on their individual presentation to develop an approach that will be effective for them. So how I work, I do base a lot of my work out of cognitive behavioral therapy because it is kind of the most well-researched and considered to be the most effective, one of the most effective treatments. But it also, I like it because it works. It just really,
Tell us
really,
what it
really
is.
works. I know, this is the most important thing. So people, in response to their life experiences, develop certain ways, certain responses, thoughts, behaviors, feelings. And a lot of times, over time, those responses sort of become patterns
Oh, I could imagine
that
they
are
do.
that are ingrained into how they respond. And while those responses at one time might have been effective or had a purpose, as they become more entrenched, the person loses the awareness of the fact that they're actually using those, and they may no longer be effective, but they're still continuing to use them.
It just becomes almost reflexive
It's
to do it.
a reactive kind of mode at that point, not conscious, not aware, but just this is sort of like those grooves, those synaptic grooves have been grooved.
It's called being in a rut.
True, stuck is the official term, right?
Oh, stuck is the official
Yeah,
term.
but at any rate, so the cognitive behavioral therapy is really, really good at helping a person sort out those responses, to be able to kind of, you've heard me say this a lot, but it's just like peeling away those layers, to be able to find out, what are these thoughts? Do they still work? What are these behaviors? And once that awareness has been created that, oh, maybe these are not working for me anymore because I'm in distress and I'm not really feeling that I am approaching my life constructively anymore, that then you start to talk about the skills that that person can learn, ways to break those habitual behaviors and thought patterns, and be able to adjust and create new ways of responding that ideally are more healthy. So there's the awareness piece, the learning different ways of responding, and then actually going out and practicing those, because those are things that are going to have to be learned in real time. You're going to have to go out into your life and practice those new responses until they become more a part of your
Does
response
this take
pattern.
20 years or more?
I know. This is not analysis, I guarantee you. I mean, the goal is for it to be brief and solutions-based, but that said, it takes different amounts of time. Some people are like 2 or 3 sessions and it's like a light bulb went on.
Is that right?
But for a lot of people, it does take longer, and it's not, there's always more variables in play than just that as well. So,
But we're not talking decades.
no, we're not. I mean, I think the goal is for it to show for the person to experience some relief pretty quickly. I think one of the best parts about it is I think that it helps a person feel like they have the ability within themselves to initiate the change.
Right.
Because, I mean, there's a lot of life experiences that we can't control for. We can't control for the fact that we're sick, or that we're having other things happen in our lives that are difficult. But what we can do is work at becoming better at how we respond, so that it doesn't create distress and the more common symptoms that we see related to anxiety or depression.
Okay.
So what I heard you say is, don't be turned off by the fact that you're not going to get an immediate response, because that can definitely be the case. And then secondly, to know that you are able to help yourself to a considerable degree once you understand what the problem is. Did I understand that correctly?
Those are really good. The one kind of a different kind of cognitive behavioral therapy that I really, really like is called acceptance and commitment therapy. And I think it's really important because what it says is that, having bad things in your life and having good things in your life are not mutually exclusive.
Right.
So that means that you can still continue to have a good life even though you may have a chronic illness, or you may have lost your spouse, or any number of different things, because a lot of times we kind of tend to go in that binary way where it's like either or, especially under stress. Then it gets real black and white. So as a result, if we can allow people to see that, yeah, this is happening, but that doesn't exclude the fact that these other things are in your life that are rewarding and positive.
Yeah.
So yeah, I mean, cure, you know.
Yeah. Cure is a tough word.
It is a tough word. And it's kind of a setup.
Yeah. You agree it's a setup?
I agree it's a setup. You can have improvement.
Yes.
You know, cure, you know, is different for everybody. Cure means different things. But, you know, just improving your quality of life is huge.
Yeah.
Is huge in this setting with this topic. So I do medication management. Medication management could be you've been on an antidepressant for a long period of time and you don't feel like it's working anymore.
Right.
Primary care will refer to me, and you know we can make some changes. We can add some things. We can take some things away. Medication management pairs beautifully with psychotherapy. I really do think that, you know, working with Kathleen, we can get someone feeling so much better, especially, you know, together versus, you know, here's a pill and you're going to be better. It doesn't work like that.
Right.
And when I do start a new medication, it's important to know that, you know, it doesn't work right away. 2 weeks to 4 weeks, you'll start to see a little bit of a difference. 6 to 8 weeks is like a full therapeutic.
Is that true with most of the
Most of them.
psychotropic drugs?
Yeah. Especially antidepressants. You know, if you're feeling bad, you want to feel better immediately.
Yes, of
And
course.
it doesn't work that way. We have to give it time, and people get really frustrated with that. You know, but when we pair it with therapy, you know, Kathleen is working on thoughts and how we approach, you know, our reactions. And with a little bit of medication, giving your body that little extra serotonin that it probably needs, you know, it pairs nice together.
So you're saying that your recommendation, both of your recommendations, is to combine the two approaches, the drug and the talk therapy.
Well, I think that talk therapy needs to be the first step. Talk
Okay.
therapy needs to be the first step to see what's going on.
Now that's probably going to be serious news to a lot of folks who tend to think, gosh, if I take a pill, I'm going to feel better.
Right, right. And that's kind of managing that expectation that there's a quick fix. Because there's not, I don't care which mode you're coming at it from, it's not an immediate reaction. And again, it does sort of set you up for more distress sometimes when it doesn't happen as quickly as you want it to. So if we can manage those expectations at the front end and then bring in the medication as well. I think that, you know, that I found something, but I think the research shows that, like, separately, either medication or psychotherapy is like a, 50 to 75% success, whatever success means rate. But if you use the two together, I think it bumps it up to 75 to 90%.
Is
So
that right? So there's a
that's-
dramatic demonstration of both
Yes.
together
Yeah.
being more effective.
And I find, I'm sure you do too, when people, you know, we do med management, I also do some psychotherapy. When I'm done talking with someone after our session is over, they'll say, I feel lighter. I feel like I got things off of my chest. And that's not the medications. I haven't even prescribed anything yet. You know, but just to come in and vent to somebody that's not their spouse, that's not their neighbor, that's not their friend, to have this neutral party that, you know, you kind of give suggestions, things that they didn't think of, and they get things, you know, they start to resolve things on their own, and they feel lighter after just talking with someone, which is wonderful. So if you're looking for a quick fix, you know, with medication, that's not it. But definitely the therapy, you can, you know, you lift some of that burden every time you come in.
Yeah, I call that the effects of the therapeutic alliance. You know, I mean, that partnership, that's what we do. We partner with our clients to be able to help them to feel that they've got somebody in there with them that's going to support them until they're able to kind of go on their own.
Yeah.
One of the programs that we did fairly recently on Vantage Point was listening, and the importance of having people who will listen to us.
Right.
So, you know, I think that with what we're talking about, we talked about the team approach. I think that the physicians, nurse practitioners, and others who knows whom we'll have in the future, maybe PAs, all have a role to play in this. Now we have a lot of folks who are on psychotropic drugs. So if we just looked, for instance, at anxiety, and you mentioned, Kathleen, that anxiety and depression are the two commonest problems. We have a lot of anxiety as a medical problem. I'm not using the English language word, but as a defined medical problem in our community. And you know, people, as you said, have been on medication for a long time. They are concerned about making any change. Sometimes when we recommend, and we need to recommend this more often, that they consult with one of you, folks are somewhat tentative. You know, they say, I don't, the responses are variable. They can be, I don't need it, I'll think about it in the future. And as I try to understand what those responses mean, I think that because they have a pre-existing relationship with the physician or the nurse practitioner, they're comfortable talking about the problem. They think, oh gosh, I'm going to have to talk about it again, or really it's under control, why do I need it? And you know, maybe an anti-anxiety drug will not be necessary. Now, there are some circumstances where this may be an acute problem. Both depression and anxiety may be acute problems. And one that comes to mind easily is the passing of a loved one. And when that happens, you know, folks will come in with a variety of complaints, which may not relate to their pre-existing medical conditions. And as you listen to it, you realize that these are related to coping difficulties and the grief that they're experiencing. But this may express itself in terms of physical complaints. There may be headaches, there may be sleeplessness, there'll be loss of appetite, there may be myalgias, weakness, and a whole slew of symptoms. There's an entire spectrum. And the providers really have to be careful to assess that and not to take each individual complaint and try to establish an investigative path, because that's not what is needed. And that's why what you mentioned about listening is so important, is being able to use that holistic approach to determine, is this a physical problem? Is this a mental health issue? Or is it a combination of the two? And it can be any combination thereof for individually.
And I would say for grief, a lot of times it's just a normal reaction.
Yes.
So I think that we are always wanting to make sure that we don't pathologize
That's right.
a reaction.
That's correct.
Because a lot of times it's a very appropriate response to a situation that over time will pass. And if we overreact, then we can actually contribute to the problem. So that's definitely something that we are aware of.
Much as everybody thinks when they go to the physicians know everything, I would say that it's an ongoing learning process. I saw somebody some moons ago who came to me with whom I'd never seen before, with many complaints, and after the second visit said to me, "You're a good listener, but now having talked to you twice, I don't really think that there is a physical problem. I'm just grieving." You know, so I think that that listening component is important, not just, you know, as you mentioned, when they come to you, but for the physicians and the nurse practitioners as well.
Absolutely.
We lose it when we forget to listen to our patients because we are so quick. The way medicine has evolved over time is that you've just got to keep moving. And keeping moving is good, but not if it comes at the expense of missing what's going on with the person. So you've got to listen, take things at face value, and then use your critical thinking skills to determine what exactly is the problem and what should be the next step. And then we have to do a better job at persuading some of those who are tentative or not really willing to go see one of you but really want a pill instead. You know, and we'll say, well, can't you give me something? Well, of course I can. I can prescribe an antidepressant. And there are many antidepressants, no paucity of them. But, you know, is that the best thing to do? And sometimes for expediency and to get things started, it may be. But having that additional layer, as you said, the peeling of the different layers is important, so we can establish cause. When we can establish cause, we're much more effective at treatment than if we don't establish the cause, right?
Let me ask you a practical question. Medicare does cover your services?
Yep.
Is there any limitation on the number of visits or anything of that sort?
Nope, other than just documenting medical necessity.
Yep, as long as there's.
Do you have to show, like physical therapy folks or the outpatient rehab, do you have to show improvement?
No.
Thank goodness.
They measure steps and,
Oh, yeah.
right.
Yeah.
Well, that's reassuring actually, because for a lot of medical problems, at least the private insurers have a limit to how long you have to treat
Right.
that patient and get a good outcome. You can treat, but you can't always assure a good outcome because that's affected by so many variables. So do not have a specific limit that is X number of therapy sessions or
Right.
X number of visits with you, just again speaks to the fact that it takes time.
Yeah.
It's not a rush job. It can't be completed by tomorrow. You can see the person, but you cannot complete and assure an outcome. It's something you have to keep working at, and it requires patience.
Yes.
It requires patience. You know, it's not like a cold. If your cold is not better in 3 or 4 days, I need something else. Here it just means that it's got to be ongoing, right?
Yeah, but change is possible. I think that I just consistently am so surprised because you have patterns of behavior that have been established with some of my clients for like 80, 90 years.
Yes.
And I think that, you know, people might just say that person's not going to be able to change.
Right.
And people change all the time. And that's what's just a testimony for
80
me.
or 90 years, isn't that?
Yeah, that, you know, people
Sure.
are resilient, and you know, if they're having distress, then, you know, eventually it makes sense to them to maybe change what's
Well,
happening.
are most of them who are coming to see you motivated already when they walk in the door?
I think a lot of people are. You know what I think is that this show, you know, and the shows that we do that kind of talk, I don't think people understand what mental health practice looks like. You know, certainly what
Because it's changed so.
well, it's definitely changed. I mean, it's not analysis for sure.
Exactly.
Which is, you know, years and years and years. And it's based on being able to provide some solutions. So you're not like kind
Yes.
of, it's not an amorphous process. It has some specificity to it. And I think that, but I think that the more people know about therapy and about the benefits of medication, I think that they're going to see that this can be a very worthwhile endeavor for them.
So awareness is really important. And so I want to relate to you an instance from last evening. When I brought the mail in, notwithstanding the snow and all, there was a journal from the DC Bar Association. So I'm not an attorney, but I have many in my family. They consider that journal to be a throwaway and routinely tell me they don't need to read it. But I look at the title and see what the lead stories are to see if there's something that might interest me. And lo and behold, the 2 lead stories were, one was about the opioid crisis. The second one, I had to chuckle when I read this, was how some practices are now establishing a cannabis component to their practice, given the use of cannabis to help their clients. And then the second lead story was actually about mental health. And the fact that there is now recognition that mental health issues are very significant in the lawyers. In big firms, in small firms, you might think they're more when there's a single person, but they're there in big firms. And the point that they were trying to make is because there has not been the awareness of mental health, and because in the past there's been sort of a stigma. The word mental health doesn't have a very good connotation to it, and so I'm not going there. But we want to dispel that notion because we want to increase awareness and say, well, you know, if your leg hurts, you go see the doctor. So if something in your mind is bothering you or you're anxious, something hurts, because mental health is about emotional, psychological well-being, and that impacts your physical health. And so that awareness is really important, and I was glad to see that, you know, in the bigger law firms, they are now designating individuals who are going to help do this. In fact, there's an attorney who wrote an article, and he got so much attention, so many people wrote back. He's barely practicing law. He's going around the country speaking at law firms about addressing and increasing awareness about mental health. So mental health is not taboo. Mental health is part of who we are. Our minds, after all, rule our bodies. It is mind over body. And so we can't but emphasize enough how important it is, how we meaning not the mental health professionals, but maybe the rest of us haven't done as good a job. And we really need to increase that awareness. We need to inquire about anxiety. We need to inquire about depression. In fact, there's a depression screen that we can do that is also paid for by Medicare. And the purpose of this, again, is to pick it up early. We don't want to wait until it gets really bad, until, you know, there's psychosis associated with it. We want to pick it up early. In fact, depression screening is now even being done in schools. So, you know, it's part of who we are. It's part of how our society has evolved. And, you know, it's wonderful that we have a team, not just a person, but a whole team to address this.
Yeah. Well, in light of what I was talking about in terms of changing, you know, how people think about things, when you were saying that a lot of times people didn't want to, the idea that they would need mental health counseling or some kind of treatment would mean that there was something wrong with them. I would like to change that for people to see that that actually very well means there's something right with you, because you're recognizing, you know, that you're in distress, that you don't want to be, that you want to have a better life, and that there's a way to do that. So that makes you stronger.
Yeah, and I like how you said, you know, don't let it get to the point that you're in, you know, it's so severe that you can't function. You know, get help soon. Get help, you know, when you need it. It's important.
Talk a little bit about the assessment tool. You're saying that the physicians can do this under Medicare.
Yes, so it's just a series of questions, simple questions, you know, such as, do you have an interest in what you're doing? Are you still socializing? I'm just doing broad strokes here, not the specific questions. Do you derive happiness from doing the things that usually you were doing?
Do you use this too?
Probably I do it more organically, as opposed to giving a...
Yeah, one of the things that a number of people have said to me was the last time I went to the doctor, they wanted to do a depression screening, and nobody quite knew what this was all about, including myself. But what you're saying now is that this is a new tool that the physicians have, and we'll be using it routinely. That was simply not explained to folks, so I think that is important.
So in fairness,
we're getting down now, I see, to the last seconds.
So in fairness, we have had a lot of tools. Maybe we, the physician community, the practicing community, haven't used them sufficiently, and we should do a better job doing that. But most importantly, what we set out to do today was to say, it's okay to get help. And it's better to get help early. You don't want a flat tire. You want to pump air into your tire before it gets flat. We have a whole team to help, and it is a team approach. And, you know, it's going to take the talk therapy, extremely important, followed by maybe medications if they're needed to help get you better. But the most important thing is to think, again, mind over body. Your mind deserves the same attention that your body deserves. Please listen to it.
Very nicely said. All right. Well, thank you, both of you, for coming today. This has really been very interesting, and I think a lot of folks are going to learn a lot from what you had to say.
Thanks
So,
for having us.
Thanks.
Thank you.